You probably know vitamin D as the sunshine vitamin. It is that conduit between us and the life-giving properties of the sun. But you might not have known these three amazing things, these amazing qualities about vitamin D that are often unknown. Of course, the first thing to mention is that vitamin D is not actually a vitamin, it is a hormone. But right, onto the benefits. So number one, vitamin D appears to protect us from dementia. A prospective study done by the National Alzheimer Center of over 12,000 people showed that just having adequate exposure to vitamin D, in this case supplementation, showed that they reduced their chances of Alzheimer's, dementia by 40%. Currently, there are nearly 50 million people around the world diagnosed with dementia, and this number is expected to triple by the year 2050. If you know anyone with dementia, a family or a friend, you can understand how impactful it can be, how devastating it can be to them and the people around them as they lose their memories and their personality and everything that made them who they were. As it stands, there really isn't much in the way of medications that we can offer to either prevent or treat dementia. But a lot of research has gone into the modifiable risk factors that we can look at in terms of what can you do in your life to reduce your risks of developing it. Vitamin D appears to be able to help eradicate amyloid beta aggregates. These are tangles of proteins that are the hallmark of Alzheimer's disease. And vitamin D helps to protect the nerves. So in order to protect your precious memories, the things that keep you warm at night, then I would really encourage you to ensure that your vitamin D levels are at adequate level. Number two is that vitamin D seems to have an association with pain, in that it appears that people who are chronic pain sufferers are more likely to have low vitamin D, but they're also more likely to require increased doses of opioid analgesia to achieve pain relief, i.e. they need more painkillers to be pain-free. Recent interventional studies have shown that vitamin D supplementation does seem to have some benefit in those with musculoskeletal or cancer pain where there is deficiency already. The mechanism is not entirely clear as to why this is. However, it does seem that it appears to be able to help modulate some of the inflammatory cytokines that contribute to our pain response, and in doing so help diminish our pain. So if you are someone who's suffering from pain, it can be incredibly debilitating and demotivating. But if you have musculoskeletal or cancer pain and you can establish that there is a vitamin D deficiency, by simply correcting this deficiency, you might be able to relieve yourself of that, or at least reduce the amount of analgesia you're having to take to achieve pain relief. All of these analgesia, of course, come with their own side effects, and so in that way you can reduce the burden of side effects. If you're enjoying this video or finding it even slightly interesting, then I would love to have you along for the journey. Please do subscribe, hit the ring ding ding bell, and it'll be the easiest thing you do today, but it might just benefit you for years to come. So number three is infection. For a long time, vitamin D has been associated and understood to have a key role in infection. It helps both regulate their innate, so natural immune system, but also our adaptive, acquired immune system. The receptor that binds vitamin D is present in your B cells and T cells, these are white blood cells, as well as antigen presenting cells, which are another key component of your immune system. And they're also able to synthesize the vitamin D metabolites themselves, and in this way they manage themselves, and this is how vitamin D helps regulate your autoimmune system. Therefore, vitamin D deficiency has an association with autoimmune disorders, as well as having an increased susceptibility to infectious diseases, having links with tuberculosis, influenza, i.e. the flu, the common cold, HIV, and even COVID. So vitamin D appears to be able to inhibit the pulmonary inflammatory response that often is part and parcel of a lot of chest infections. And what's more is it is able to boost our innate defenses against respiratory pathogens. A study in the British Medical Journal, a meta-analysis of over 26 different randomized controlled trials, showed that by giving vitamin D, it massively reduced the chances of developing a respiratory tract infection, and this benefit was seen greatest in those who were the most severely deficient. And this may go, at least in some way, in explaining why we always seem to get more sick during the winter, having colds more frequently. Of course, in the winter when there's less sun exposure, therefore we're developing less vitamin D, and therefore the theory being that we are more susceptible to infections. For countries in Europe, the probability of contracting and dying from COVID-19 was actually inversely related to the country's mean population vitamin D status. Supplementing this link, a comparison was made between climate and COVID-19. What it showed was that every degree north of the 28 degrees latitude was associated with a 4.4% increased risk of COVID mortality. Now, of course, there are plenty of confounding variables here, so it's not a perfect science, but it might shed some light on as to why vitamin D is protective against these respiratory pathogens. What these studies show, though, and an abundance of more out there, is that the hormones and vitamins that we have inside us have no one singular purpose. They have a multivariate, complex array of tasks to fulfill around the body, involved in so many different processes, and therefore it's important that you don't jeopardize a whole collection of processes by being deficient in them. And thus it is important, therefore, to address the simple elements that constitute a healthy life. And in the case of vitamin D, ensuring you get some sun exposure, spend some some time in the light. And if you aren't getting enough time, if you're unfortunately having to spend a lot of time indoors or a place where there's not a lot of sunlight, you're not getting enough exposure, particularly during those winter months, then you can think about supplementing. And when we think that hypovitaminosis D, or low vitamin D, affects between 13 and 50% of the world's population, with the greatest prevalence being in Northern Europe, Asia and the Middle East, then there's a fair amount of work to do. Anyway, take care.